Yeah.
The broadcast is now starting. All attendees are in listen-only mode.
Hello. This is Dave Fukuzawa with the Kresge Foundation, and welcome to today's webinar on the Human Services Program. We're going to wait just a few minutes as a few more people get registered, so just stay on the line and we'll be right with you.
Okay.
Hello, this is the Kresge webinar on the Human Services Program. We're just waiting a few more minutes before we get started. Hello. Welcome to today's webinar on the revised Kresge Human Services Program. I am David Fukuzawa, the Managing Director of the Health and Human Services teams. We are delighted that so many of you are able to join us today. This is actually the second of two webinars that we are hosting on the Human Services Program. Our first webinar, which was a week ago, was aimed at current and previous grantees. We have prepared this webinar especially for organizations that are not previous Kresge grantees, at least within the last 5 years. If you are not a grantee but have applied in the last few years, we think that you will see much continuity with the program you apply to, but there are also some very important questions. So here's today's game plan. We'll introduce you quickly to our team, or introduce you to Kresge and then to our team, and then go into the program and cover the changes, follow that by an explanation of the focus areas, and then we'll allow time for Q&A. So very quickly, for those of you who may not be familiar with Kresge, we are a national foundation founded in 1924 with the goal of expanding opportunities in America's cities. We're about a $3.6 billion endowment, and we fund through grants and social investments, and that is through 6 program areas, which includes health and human services, and 2 practices, the social investment practice and American cities. And this is our team. I'm Dave Fukuzawa, and joining me today will be Sandy Ambrosi, Michael Shaw, Guillermina Hernandez Gallegos, Ariel Milton, and Christina Karras. And we also have Joyce Holloman and Fred Karnas, who also help with our team. So some of you may be asking, why these changes and why now? And every 2 to 3 years, each of the 6 program teams, as well as the 2 practices, goes before our board to review the program and to recommend revisions and adjustments. The purpose of this periodic review is to ensure that the programs continue to be responsive to both external and internal changes and variables. And in the last couple of years, there have been very many big changes, certainly on the outside, but also some very important ones on the inside. Let me just mention one very important major internal change, and that is the increasing importance and centrality of the Kresge Urban Opportunity Framework and focus on cities. So this is reflected in the new Human Services Statement of Purpose. We support the advancement of human services to expand the social and economic mobility for people with low income in America's cities. What's different in this statement from the previous and earlier ones is the explicit focus on social and economic mobility, and also on people with low incomes in the cities. What remains throughout this, however, is our commitment to advancing and serving the human services sector, especially the nonprofits, which we have been supporting consistently since 2007 from a programmatic point of view, and even longer when you look at a long history of challenge grants. So these are the new focus areas. Advancing innovative multi-sectoral policy solutions in human services, fostering the next generation of human services organizations, and building place-based opportunity ecosystems. We're going to spend most of our time in the presentation on describing what is inside these areas and what they mean and why we came to them. But first, Michael Shaw is going to take us through the process of how we got here.
Thanks, David. I appreciate it. So a main reason for the refresh, as David spoke to, were real changes that we saw in the sector. And we felt the real need to take the opportunity created by recent transitions on our team and internal factors within the foundation, like the stronger orientation to place and city, to respond to those changes in the sector. In order to develop our revised strategy, we conducted a wide range of activities and consulted with thought leaders, stakeholders, grantee partners, and peer foundations. Some of these activities included interviews with more than 50 independent experts. These are folks who have good perspective on the direction of the field, where it's been, where it's going, analysis of the field, which was a scan of where others are investing or not investing, amongst other trends. We reviewed more than 100 human services grants that we've made in the past or we're currently running. We reviewed their proposals, reports, and other products that were generated. We consulted partners on our Kresge staff. These are folks from other programs, executive leadership, and our board. We conducted a literature review of dozens of academic articles and commissioned reports, and we worked with FSG, a national consulting group, to craft a theory of change and learning goals. This was an opportunity for us, as a team, to engage our field of partners and each other to explore the challenges and opportunities facing the sector and those we all serve. Thank you so much for your generosity through this process. We've engaged many of you. We've consulted with your work and been inspired by your work. And we hope that this response is something that's clear to you and something that makes sense for the sector. And now it's my pleasure to transition to Sandy, who will share what we've learned throughout this whole process.
Thank you, Michael. As we all know, there have been significant changes, especially over the last 8 years, that have impacted the human services sector. And we've bucketed what we learned into 5 areas that you see on your screen: societal, policy or regulatory, field, organizational, and consumer or client. In brief, at the societal level, there are narratives about people with low incomes both positively and negatively influencing the political debate and the conversations about our social contracts with each other. At the policy or regulatory level, government funding continues to decline due to cuts and/or new priorities, plus government payments continue to be late or insufficient to cover the full program delivery costs while expecting all the work to be done. And there are also changing payment models, including pay for success, social impact bonds, which are focused on outcomes or performance. And with a growing emphasis on outcomes, there's an increasing demand for evidence-based programs and support. At the field level, there is an evolving understanding of effective practice, with heightened emphasis on research, evidence, and data, including an expanded awareness of the importance of brain science. There's also an increased willingness to explore new areas of focus and methods of delivery, including approaches that integrate health, housing, and human services. At the organizational level, there's a greater emphasis on adaptation, resilience, and connectedness, including adapting to changing client needs, science, funding sources, and evidence-based requirements, utilizing communities of practice and cross-organizational collaboration to better execute and achieve impact and outcomes, and embracing a customer or client-centered approach. And at the client level, there continues to be widening opportunity gap, especially for young men of color, and complex and increasing needs. These obviously lean into and influence each other, with many themes running through all the levels. The role of philanthropy, especially a national one, is to invest in the bold changes underway and to help the sector reset the odds so that more people have greater choices and chances to thrive. And now I'm going to talk about one of our focus areas, particularly the advancing innovative multi-sectoral policy solutions in human services. Much of our policy work will continue in the refresh strategy. As mentioned, we've learned at the policy or regulatory level that there's an emerging bipartisan focus on evidence-based programs and supports. And there are changing payment models focused on outcomes and performance. In addition, we believe the Affordable Care Act provides a significant opportunity to address the social determinants of health through prevention and intervention. And so such work is at the heart of the human serving organizations. In this focus area, we're going to continue to look for advocacy and research opportunities to strengthen the way the human service sector through the adoption of integrated evidence-based policies, regulations, and funding that expand social and economic mobility. This will be our only open portal with requests reviewed on an ongoing basis. Grants may be single or multi-year, and on average will be between $300,000 and $500,000. We will make investments in a range of work, including advocacy, convenings, research, and public will-building campaigns. And we will consider all types of requests, project, operating, and planning. And while there are many policies that help expand social and economic mobility, we are specifically interested in policy work that impacts the human service sector. In particular, policies that remove systemic and structural barriers for people with low incomes, policies that advance evidence-based, integrated, and holistic approaches and practices, policies that integrate financing and delivery systems for health, housing, and human service providers so that supports are interdependent and mutually reinforcing. It's important to note that we will not fund efforts that are considered lobbying by the IRS, single-issue advocacy efforts, and voter engagement or voter registration activities. We don't have the resources or the appetite to be a full policy shop, but we believe strategic investments that model, test, and replicate more supportive and integrated policies and financing will help accelerate social and economic mobility for people with low incomes. And now it's my pleasure to turn it over to Michael, who's going to talk about our other focus area.
Thanks, Sandy. So I'm going to speak about fostering the next generation of human service organizations. Now, what I promise you here is this is going to be too dense, too fast, and possibly too jargony. So just know we are recording this. It will get posted to our website so you don't have to scramble. And also feel encouraged that when you submit questions to the webinar, we are looking to respond to them at the end. So please submit your questions as we go on. So we've adopted the Stanford Social Innovation Review's definition of a social innovation, that being a novel solution to a social problem that is more effective, efficient, sustainable, or just than current solutions. The Human Services Program further defines innovation as pioneering and game-changing efforts that are transforming both the mindset and approaches to expanding economic and social mobility at the societal, sectoral, organizational, and person level. Kresge will support organizations that operate human service programs strategically and with a mind for the future. While there are many activities underway that may be considered innovative, our specific point of view related to the human services sector focuses on being more person-centered in the way you develop and deploy interventions and operating in a manner that is outcomes-oriented or performance-based. For us, person-centered means interventions that are developed based on client needs and impacts, rather than the funders or implementers, with a relational framework to co-create solutions with constituents. We genuinely seek to propel organizations that are promoting the person as the focus of the work. And for us, outcomes-oriented means organizations and programs focused on lasting impacts for the recipients. We want to push organizations that are achieving economic and social mobility rather than triaging crisis and have the evidence to prove it. Kresge is looking for more than adoption of these practices in the field. We're looking for models that are emerging as nationally compelling and shaping the field. We believe that whether you are an iterator or an inventor in the space, you are at one of three developmental phases. We believe that innovation is achieved through two primary forms of human services, through iteration or through invention. For us, iteration occurs through incremental improvement of an existing organization's work to refine their approach, strategy, and intervention methods in order to achieve improved impact. Invention occurs after evaluating community and social needs. An inventor identifies a need or gap in the market and creates a new solution. We believe that whether you are an iterator or an inventor in the space, you are at one of three developmental levels. You're at design, demonstration, or deployment. Design phase is when you are at a concept and planning. Demonstration is where you are executing some implementation and establishing sound proof points. And deployment is when you are driving at expansion and broader reach built on evidence and sound organizational principles. Kresge is ideally focused on organizations that are moving from demonstration to deployment. We feel that this is a critical phase of influence in an organization's life cycle and for their ability to influence the sector. Primary ways that we're going to invest. We're going to invest in innovative providers who are advancing person-centered and/or high-impact approaches. These are direct investments that will be made to innovative providers to further integration and interoperability between three systems: human services, health, and housing. These organizations all have increasing interreliance, overlapping client populations, and related funding streams. We'll identify and support these entities that are driving change in practice, operations, financing, and policy by having impacts in the cities they operate and show promise for application in other cities. We're also going to invest in infrastructure organizations who are advancing these efforts. Infrastructure organizations are the networks, research groups, community development financial institutions, technical assistance providers, and the like, who are operating as vehicles for building field knowledge and expanding innovation. We will draw on the experience we gained in our previous strategy iteration working with these entities, and we define sector infrastructure organizations as being able to reach a group of human service organizations that aim to solve difficult problems by working together, adapting over time, and generating sustained flow of activities and impacts that drive solutions forward. We believe that these infrastructure organizations are exceptional vehicles to incubate innovation and disseminate lessons and practices. We are going to identify these opportunities by invitation only, meaning program staff will be sourcing and identifying strategic opportunities to support ways of work and organizations that are changing and influencing the sector. Previously, we had maintained an open portal as a means of recruiting opportunities, but we believe that through our own direct sourcing, we will be able to be much more efficient and targeted with our investments. However, we encourage folks to continue to monitor our website for RFPs and special funding opportunities as they become available. So as I said when I started, this is going to be too dense, too fast, and possibly too jargony. So the quick recap is we are going to be directly sourcing these funding opportunities for providers or provider networks that are promoting innovation as iterators or investors, that are shaping the field through person-centered and/or outcomes-oriented work at the point of moving from demonstration and to deployment. And finally, we look to continue to provide general operating capital to accelerate these organizations. We understand the importance of flexible capital in order to move efforts forward and look to continue to maintain that effort. It's my pleasure to transition to Guillermina to talk to you about building place-based opportunity ecosystems.
Thank you, Michael, and good afternoon, everyone. Our strategy to support building place-based opportunity ecosystems has evolved over the last couple of years by having, as Michael and Sandy shared with you, spoken to lots of folks and learning from what's happening on the ground. So our hope is to focus efforts in a select number, a smaller number of cities that are ready to create sustainable, integrated, person-centered networks of supports and services that are anchored by human service organizations. And what are one of the most important lessons that we learned was just how central and critical relationships were among nonprofit organizations and the human services, the public agencies and funders, and how these collaborative efforts have led to shared visions and shared understanding of what the outcomes are. So our hope is that as we look to invest in these limited number of cities, that we will be gaining from the experience of our high-performing grants, where we have special knowledge among our team and a network of existing relationships, so that these are consistent with the trajectory of the energy in the city to support creation of new opportunities or stronger ladders for social and economic mobility. And our hope is also that we will be looking at places that already have a potential to build a very healthy and robust ecosystem that can also be measurably that is also willing to be accountable and measurable in its progress towards creating opportunities in place. So for the next 6 months, we will be developing the strategy with hopefully with a collaboration with some of you, and so please do stay tuned. This strategy will be as the previous one, which will be by invitation only, and we're eager to hear also about different ideas. Our hope is to maybe by September have something that will be more public, so please stay tuned. Thank you.
Yeah, thank you, Yermina. I know there'll be a lot of questions. We had on the first webinar about what we mean by ecosystems, and just to clarify, you don't have to be in a certain city in order to get a grant. The third area, which is really our newest program area, as Yermina pointed out, is to be developed. And there's some big questions that we have to answer. But it is our sense that in order to really understand how people get to opportunity, it is not through any particular program or even organization, but how all those organizations and supports and services really work together, both at a local level as well as sort of multiple levels even within a region or a state. And so with that, we're at Q&A, but before we get there, I just wanted to add a few comments and looking and reflecting on what we just told you. Because some of you will be asking, why it is, that we are sourcing some of these areas and leaving just one area open. Our experience over the last 8 years has been that only a tiny percentage of proposals was ever approved. This did not seem a good use of applicants' time, who spent sometimes hours in a week completing an application, nor good use of our time. Further, as a national foundation, our role, we felt, it was to really highlight the best work going on. And while there's a lot of very, very good work at local levels, we could not simply support every good local effort. We had to really try to figure out, what are the efforts that really rise above and represent examples really for the field. Two, this selection process actually put the Human Service team in greater alignment with the other Kresge teams. The Human Service team was the last team with a completely open portal. I know that some of you may be disappointed in that, but this has really been the process for the other 5 Kresge teams as well. Third, the new process would allow us to focus more attention on giving the field the attention it deserved by lifting up what and who is working to lift people out of poverty. Again, it has been our observation that philanthropy, especially national, tends to focus its attention on the best programs and policies, which are not unimportant, but less on the organizations that actually do the heavy lifting. And our focus, as we work especially closely with our communications department, is to begin to think about the leverage points that we can use to really give greater visibility to the good work that's happening on the ground. And with that, we're ready to turn to questions. And I will just say as a preface that I just know we're not going to be able probably to get to every single question, but we do have a record of those questions, and many of those questions will be able to be posted on a revised FAQ section on our website. So we have some questions here about process. So is there a wait time to apply after a declination? And the answer is no. You can continue to apply. Our experience, though, is that whether you're applying to Kresge or anyone else, you should probably pause to take note of the fact that if you did get a declination, there was probably a very good reason to do so, and that if you come back for the same program, it's likely not to get funded. Does Kresge, another question is, does Kresge have a particular population of interest? That is, are we focused on kids or older adults or immigrants, that sort of a thing? And the simple answer to that is no, or at least we have not. The foundation as a whole has an interest in boys and men of color, and to the extent that we can accommodate that within our program, we do try, and we take that as a serious consideration. We have not focused on a specific population. So that still remains pretty open. Another question here is, does the info shared with the public via the webinar, I guess today's webinar, apply to PRIs as well as grant requests? Pretty much, although we actually don't have a process for entertaining PRIs per se. We have a social investment practice unit which really handles most of our program-related PRIs. For those of you who don't know, are program-related investments. So foundations can actually make loans, typically below market rate loans, so a loan at a lower interest rate that you could get at another lender for social purposes. So we actually have a unit that does the due diligence on that, on those PRIs, and we are eager to find opportunities where we can marry grant program strategies with a PRI strategy. So we're a little bit different than maybe some other foundations. If you're familiar with PRIs, we don't source them independently. We try to find those things which really both meet a financial goal as well as a programmatic goal. We have a question here about cities. What cities are you focusing on for the place-based opportunity ecosystems? The quick answer is we don't have any particular focus cities yet. I think what we're trying to do is understand, what will be the kind of criteria for selection, even including what size of city, we should focus on. I will say that, given the significant investment that Kresge has in the city of Detroit, that Detroit will likely be on that list. But there will be some other places as well. And our thought is that, there may be a handful of places where we decide to go very deep, and there may be some other places where we may be able to touch down a little more lightly given existing partnerships and investments that certain places have on the ground. One can imagine a city or a place, that has focused very heavily, let's say, on the homeless population and has a well-built ecosystem, and all they're looking for is kind of what we call passing gear, grants to really get them to the next level, where we can play a role in sort of building out or completing that ecosystem. So those are the kinds of questions that we have to answer. And as Girmina pointed out, we are sort of in the process of trying to cull through all those different questions. So I am told that we have no more questions. I hope that there isn't another glitch in our system and that you're able to get questions to us in a timely way. Yeah. So if you're trying to think about a question, what we'll try to do is move on to just clarify a little bit our process moving forward. As of last Friday, our website, the language has been up for a couple of weeks already. The application process went live. So if you had an application for a policy solutions proposal, you could actually go online and start your application. So that the process in terms of at that point will be the same as it has been in the past. You start an online application after you register. We review the letter of intent, and if we think it deserves further consideration, we'll invite it for a full proposal. As for the innovators area, we are actively sourcing proposals at this point. And a couple of things about that. Michael did a great job of explaining the kind of the rationale for why we're doing this and what we're looking for. And you may be asking, well, how do I kind of get in the queue or get your attention? Much of the sourcing right today has not only been through our own knowledge of the field, and we do try to get around to major conferences, especially in the human services field. And so we're pretty familiar with a lot, at least the some of the leading organizations, but many other good ones too, because we visit many cities as we go around the country. We also, as Michael pointed out, have talked to lots of experts and maybe looking to even developing an advisory group to help us identify some of the leading organizations. But we also understand, that there are a lot of very, very good organizations that are doing good work in their communities. And we are looking at, in the future, developing initiatives, which may target good local innovation. And we encourage you to stay tuned on our website to see any announcements for any requests for proposals or requests for papers and things like that as they come forward. But right now we don't have any specific opportunities for a lot of purely locally based kinds of programs. But we're thinking about it. And as for the opportunity ecosystems, again, this will take a few months for us to sort of figure out, and at that point, we'll begin to start inviting proposals, depending on how that shapes up. So I see we've got a few more questions. So one question is defining policy. Are you looking for statewide policy or local policy? Sandy, do you want to?
We're looking at policy at all levels, but in particular, if it's at the county or city or state level, we want to know that those policies can be replicated and shared across other municipalities and other areas. So, thank you.
And beyond the Affordable Care Act, are there any other kinds of policies or areas that within human services that would be of interest to us?
I think what we're taking the lead a lot from our grantee partners, and there are probably two ways to look at this. There's the approach, which is looking at integrated, holistic, person-centered policies, and applying that lens to a range of work that helps support economic and social and economic mobility for people. So we have been involved in some pay for success around juvenile justice, reducing recidivism. We've also been looking at healthy homes, which again is part of that integration of health and human service. But I think for the most part we are following the guidance of our grantee partners in terms of what are the critical issues of the time, as long as, again, they're applying that lens of integrated, holistic, and person-centered.
Yeah, and I think what's consistent with all of our work is less around the verticals, right? Less around the populations, the issues, the intervention styles, and a little bit less around place. We're going to see that evolve over time, but more around the how the sector operates, how to create the enabling environments for the sector to thrive and have impact, and less around what's specific to an issue, a place, an approach, but how we can work better.
Yeah, one of the things we're trying to answer, I think, with the policy area is that the human services sector has been so constrained, in particular since the Great Recession, but really for even probably a generation or two before that. Where there's a decreasing amount of money going to the sector, state budgets, are decreased. There's a polarized debate, as Sandy pointed out, about how to help vulnerable, low-income people in the country, and there's no simple policy fix that says just give us more money. And if it happened tomorrow, then we'd all be happy. But that's probably not going to happen in the near future. So we understand that what needs to happen is really a shift in terms of where we allocate, community resources in the large sense. So the healthcare area is important because that's $3 trillion of money that is going into a healthcare system that doesn't produce very good value. which actually could be used better in the human services sector, among others. But there's other areas where that also may be true. Certainly in the criminal justice system, juvenile justice, child welfare, even in things like housing or in community development. There's lots of money which is put into things that if we thought of this in a multi-sectoral way and understood better the role that human services could play, and human services can demonstrate its value, then we think there are policies which ought to facilitate, the reallocation of those resources. In other words, to de-siloize the revenue streams, to put them into areas where we can actually make a difference. And this is where social impact bonds and program-related investments and the like also come in, because private capital can also play a role in supporting some of this work. Another question on place. Will the foundation be soliciting ideas while building place-based opportunity ecosystems? Yeah, we are actively talking to lots of different people about ideas about how to do this. We're not the only foundation to think about place-based grant making. There's been lots of foundations that do this. But what we're trying to figure out, is what in particular can we make investments that really help the human services sector. In other words, highlight the role that they play in building opportunity. Because we know that in many places the opportunity engine has broken down. And part of that is the infrastructure is broken down. And we're trying to figure out, what were the areas or opportunities where we can actually rebuild some of that infrastructure. I have a question here about the size of grants. I heard you mention public policy grants average $300,000 to $500,000 a year. Does this apply to other areas? That's probably a typical average range for our grants. So yes, that's the answer. But it's obviously not a strict rule for us. It kind of depends on what people are trying to do. So we're pretty flexible. When it gets to be very large, when the requests begin to get in excess of, let's say, $1 million, it invites a little more scrutiny, and so those kinds of grants are more difficult to get through.
Scrutiny from the board, right?
Well, the board has to. The board looks at any grants over 1.5 million, but that's a little inside baseball.
At the same time, we're looking to make grants of significance, right? So we're less inclined to make very small grants that would have very localized focus. To make small grants, they would have to be very tactical for a reason that's going to transform the sector. And for the same reason, we would make very large grants. The larger the grant, the more transformation it must have on the sector. Question, can you explain more about the focus on organizations that are moving from demonstration to deployment? Sure. So organization evolution of program development, right? From design, from demonstration to deployment. Demonstration is really organizations that are beyond that design phase, right? They've scouted it out, sketched it out, and they're now in demonstrations where they've applied their knowledge, practiced it, have a set of proof points and knowledge base, and have some sort of a plan and anticipation that the application that there's application more broadly. I'm intentionally avoiding the word scale here, a word that we've all heard too much, but really it's about broader application, whether that's through replication into more places, or whether it's through expanding services to reach more people in a place, or whether it's through technical assistance or systems change models. We're looking for organizations who are at the point where they know their thing works with some level of accuracy and are looking to expand that application of that knowledge in practice to more. And those organizations tend to be organizations who understand that there's an importance for transformation in what they do. So it's not just about localization and how this can affect a few more people in a place, but really it's around how does the way they do their work and the work that they do change those trajectories for people at a broad level.
Another question about policy just came in. Talking about social innovations, innovations within the educational sector. Would that be something of interest to us? And we want to emphasize that we're talking about policies that impact the human service sector, and that there are many policies and laws that advance economic and social mobility, but we want those that are particularly within the human serving sector to be come to us.
Yeah, and if you're having a hard time identifying if you're in the human services sector, that's generally some sort of a telltale sign that you may not be in the human services sector. So we're happy to have the conversations to figure out how you fit, but if you're working on an isolated social issue, generally that's not what we're focused on. Things that define human services for us are much more holistic, are much more about well-being, are much more client-facing, and work on integrated approaches to change with people.
Right. I will say for those of you who are a human service organization that, Kresge does have 6 program areas, and because we are in a place where we are constantly in conversation with the 5 other programs, as well as social investment in our cities, is that there's a lot of talk about areas of sort of crossover interest. So that's why the Health and Human Services teams in particular have been talking a lot about areas of integration. Housing has emerged as a big area, for example, in that particular area. But we do also have conversations with our education team, which is focused on post-secondary access and success, that is getting in and through college. I think it's posted on their website, so we can say, that they're very, very interested in themselves having an educational ecosystem, which, to a great extent, involves, how do low-income college students, first-generation college students, deal with the barriers that they have to getting to school, whether it's food or housing, things that human services organizations address.
Another question we had is, do we prefer individual organizations versus working with networks of organizations? It's a great question. They're different vehicles. Sometimes you find an innovative organization that's working independently, and we do look to find those, support those. When we're looking to work with networks, we're looking to use them as vehicles to deploy innovation to their affiliates. Most of the time, we're looking for larger networks who we can have kind of a viral impact on, and who are looking to really move the way that their affiliates are working. We don't have a preference. We need to be investing in both, because both fill up the space. So we're looking for opportunities to work with both. We're looking for opportunities for both to inform and transform the sector.
Another question came in about again, our criteria around ecosystems and where we might work, and whether or not designation of the federal promise zones or choice neighborhoods or any of those other opportunities might influence us. And I think we're to be determined. It's certainly an important and important designation for your community, and certainly represents a lot of work that you've done, but it's too early to tell. That will be central to our thinking. Oh. The questions seem to be coming in batches for some reason. All of a sudden they explode. There's a couple still around. Just to clarify one more time, what will be open and what won't be. And so as Michael and David have said, it's the policy piece will be open, open portal. Those questions, that's live now, and the other 2 portals will not be. We'll only be sourcing those opportunities. There doesn't seem to be any more questions coming in, although probably when we conclude this is when you'll start thinking about new ones. We do have an info@Kresge
email address.
email address, which there we go, up on the slide.
So if you continue to have questions that haven't been addressed, you can reach out to the email info@kresge.org. Is that the email address that you're referring to?
Yes.
And then you can follow us on Facebook and all the social media outlets, and we encourage you to do that.
Right. This is very much a process. The language you see on the website, we think it's pretty clear now. We will continue to evolve and probably adjust depending on the work and proposals that we see coming in through our portal, and in conversation with you, because we do think that this is a dialogue, with the field. We came up with this framework because of our conversations with you, and also with many other experts. We will continue to try to be responsive and to listen, to make adjustments as needed. And so with that, we want to thank you. We know that we have a lot of you on the line today, and we appreciate you taking the time, and we appreciate your interest in the Human Services Program. And we look forward to hearing from you in one way or the other. So with that, we'll conclude this webinar for today.